Hello, my name's Debbie and I'm project lead for the Reframe project. The Reframe project is a really exciting project that is focusing on creating more diverse and inclusive imagery for healthcare. This presentation tells you a little bit more about the project and how you can get involved. So what is the problem that the Reframe project is trying to address? So as clinicians and educators, what we've noticed is that many images of medical conditions and also clinical signs within healthcare resources such as textbooks, but also online materials as well, they're largely of people with white skin. And this has been emphasised in this study by Louis and Wilkes in 2018, where they examined the representation of race and skin tone in imagery contained within 4 well-known anatomy textbooks. So it was around about 4,000 images that they evaluated within these textbooks. And the study highlighted that only 5% of the images were actually of people with black and brown skin. So this shows that there's a huge gap in the representation of people, in particular with black and brown skin, in textbooks that are being used to educate healthcare students. And this isn't just a problem within medical textbooks, it's also a problem within online searching as well. You can see the image on this slide is a simple search for a chickenpox rash, and you can see that there's no representation of darker skin tones within this search. What we've also noticed is that there is underrepresentation of specific communities within marketing images of health professionals, in particular within the allied health professionals community. So when we search for images of our professions, so I'm a physiotherapist, so when I've looked for profession-specific images, I've noticed that those images tend to be of people with white skin. So there's a lack of ethnic diversity in those images, but there's also an underrepresentation of other key communities such as the LGBTQIA+, and also people who are disabled. So it's not just limited to medical conditions, we've also noticed this underrepresentation in marketing type images as well. So why is this a problem? So the gap in representation, in particular within the medical images, is a huge problem because medical conditions can actually present and look quite different on different skin tones. So for example, redness that's associated with inflammation can present more obvious on somebody with a lighter skin tone and be more difficult to recognise on somebody with a darker skin tone. So if we don't have images of medical conditions on different skin tones, then this means that we don't have a reference point of what those conditions and those clinical signs look like across different skin tones. And this can impact on clinicians and healthcare professionals' ability to then recognise the signs of the same disease in different racial groups. And this can lead to people experiencing a delay in their diagnosis or a misdiagnosis, so they could have a condition that's been diagnosed that it's not. And this could mean that people then receive incorrect treatment or no treatment and could impact negatively on their overall experience of healthcare. And ultimately, this could contribute to health inequalities and distrust from those communities that are affected. With regards to the marketing and the recruitment images of allied health professionals, so again, if we don't have images that represent the diversity of our population, then it can contribute towards people feeling a reduced sense of belonging and self-worth. And it may even mean that people don't consider themselves for particular healthcare careers because they don't see themselves represented in those images. So this isn't a new problem. It's been known for quite a while that there is this gap in representation within images. And actually there's some really good resources out there already that are aimed at tackling this issue. But they focus more specifically on medical conditions. So the ones on the slide are examples of image databases that increase the representation of skin diversity within medical images. And these ones are really great, but some do have their limitations. So for example, some include only babies and children, Some are specific to dermatology, so skin conditions. Some have fees to download the images. Some don't have the diagnostic validation with their images. So although there's some really great resources, there's still a gap within that space. With regards to the marketing and recruitment images, again, there's really good work out there within organisations. So lots of big organisations are looking at ways to increase the representation in those recruitment and marketing images. But these are often quite specific to that organisation and not open access and widely available. So there's still a huge gap across both of those strands. So we've launched Reframe, which is an NHS England funded project with the objective of collaborating with communities to co-produce a digital library of diverse and inclusive images. So what we've done is gone out and looked at what's already out there, and we are looking to fill the gaps really of existing resources. And we want to produce an image library that is open access. So it's important that this image library is available nationally and also globally to members of the public, to healthcare professionals, and also educators. We want it to be free, so we don't want to have the barrier of cost. We want the images to be high quality, so we're working with medical photographers in our local trust in Bristol, and we want the images to be downloadable so that people can actually use them within teaching and learning materials for educational purposes. We want to have a diagnostic validation, so if we're putting an image on our library of chickenpox, we want to be assured that it is chickenpox, so we're looking to diagnostically validate images with key healthcare professionals, and our platform will be inclusive of adults and children. So there are two strands to this project. We have strand one, which is focusing on collecting images of medical conditions, in particular on different skin tones. And then we have strand two, which is looking to photograph healthcare professionals within healthcare settings. So that's looking to increase the pool of marketing images of allied health professionals. So for strand one, we started within the community. So community engagement has been integral to the success of this project, and we engaged different community groups from early on, so with support with translation, with feedback on posters, with marketing our events, and really we couldn't have done it without their support. We acknowledge that there's lots of distrust with the healthcare system, so for our community photo shoots we didn't want to be bringing people into healthcare settings, so we looked for community centres within Bristol to run pop-up community photo shoots. So the image in the centre of the screen is our first photo shoot, which was back in January at the Malcolm X Centre in St Paul's in Bristol. So we took our team down there, we took our photographers, and we invited people to come along and have their photograph taken. We acknowledged that we were only going to perhaps get a specific types of conditions that way, so for example more chronic conditions and perhaps more dermatological conditions, and probably adults. So we looked at partnering up with other community groups. So the image to the right of that is a photo shoot that we ran with Black Mothers Matters, which is a national support group for Black mothers and their babies, and we knew that they met up on a Thursday, so we were kindly invited into their space to run a photo shoot within their space. We have also set up GP surgery photo shoots, which have been really successful. So we partnered with 2 GP surgeries in Bristol, and we ran photo shoots and invited patients to come along. So we sent out, a list of conditions that we were looking for and asked people to come in to a pop-up event. And we're now looking to seek out patients across inpatient and outpatient services. So we're working with our medical photographers locally and looking at how we can capture people within different services across inpatient and outpatient services. Strand 2 was very much a different approach to photography. We identified specific professions that were underrepresented, and we identified allied health professionals, and we looked to run photo shoots for specific professions. So we ran a paramedic profession, physiotherapy, midwifery, occupational therapy, and podiatry. And we recruited models for these photo shoots. So they weren't necessarily healthcare professionals, they were people that came along to model for us. We used the University of the West of England simulation spaces and equipment to run the photo shoots for Strand 2. We were also really fortunate in the Strand 2 photo shoots to collaborate with the NHS supply chain. They provided us with the new national uniforms so that we could image a wide range of different professionals within our photo shoots. As I mentioned, the communities that we have engaged with have been a huge part of this project, and it wouldn't be as successful as it is without these communities. So here are some examples of people that we've engaged with who have supported us in a variety of different ways, from sharing information within the networks, to allowing us to come and do radio shows, to signposting us to other organisations, letting us come and set up within their groups or their community centres, giving us feedback on posters, translating information. Their support has been invaluable, and we feel that we've really built trust within these kind of key communities within Bristol. And we hope that when the platform launches, we can go back out to communities and share with them the outcome of the project. So some of the conversations that we had with communities were that they sometimes felt that there was lots of good work happening, but they never really saw the outcome and the end product. So that's one thing that's really important to us, is that we try and bring everybody back together and share the end product once complete. And this is an example of what we're hoping to produce: an online image library where the images will be catalogued according to the condition. The image library will have the facility to zoom, to download, so that images can be used within educational materials. The images will also be accessible by members of the public, so if someone has a rash and they'd like to view images of rashes on different skin tones, then they can view those images. So we are hoping to produce something similar to this. So this project has already had a huge impact, partly by increasing awareness of the problem. So we have travelled the country talking at conferences, talking to different groups of people about this problem. So the awareness raising has already started. Once the platform is up and running and the images are available to access, then that's where the bigger impact will come. So if we have those images of different medical conditions on different skin tones, it means that healthcare professionals will have a resource so that they can help to recognise those signs of disease. That will ultimately help with diagnosis and provide a better healthcare experience for individuals and impact positively on health inequalities. If we're starting to use these images within our healthcare curriculum, then that can help contribute to decolonisation. And then if we have those marketing images, if we've got that representation in images of the allied health professionals, that will improve sense of belonging, self-worth, and it may actually encourage people from underrepresented groups to consider those careers as options. So if they see, a person that looks like them in a particular profession, then that might inspire them then to think about that career as an option. So our ambition for Reframe is that it is rolled out nationally and it continues to grow. So we've been working locally within Bristol with the medical illustration team and have captured thousands of images so far. We're now at a point where we are developing the platform and starting to think about categorization and uploading images. Once the platform is launched, what we would like is for medical illustration teams across the UK to continue to contribute to this platform. So we've created this rollout pack that provides you with information about how you can get involved. It gives information about standardization of image taking and some example photography settings so that we can assure a level of standardization and quality of images. So if you would like to get involved or would like to set up Reframe within your region, then please do get in touch. You can contact us via diversifyingimages@ue.ac.uk or contact us via social media. We would love to hear from you, and we would love to see this digital library continue to grow to one large resource for everybody. You can also access our current webpage via the QR code. Just a note, this isn't the final platform. This is just the webpage that was set up for the project. The digital library will be launched by March 2025. Thank you very much.